Well, good morning, good afternoon, or good evening, depending on when you're watching this. Today is Thursday, January 21st. It's 1 o'clock as we tape this message. I want to thank, to my right, Dr. Scott Rocco, the Superintendent of the Hamilton Township School District, for having us here at the school district on Park Ave. Want to thank, to my left, our Director of Health, Recreation, and Senior Services, Kathy Fitzgerald. It's been some time since the three of us got together and had an opportunity to speak with you regarding some township updates, both from the municipal government and from the school district, but obviously a lot's been going on the last several weeks. And as we made our way out of the holiday season and the New Year's season, we thought it a good time to provide you some updates from your municipal government and from your school district. I want to start off with a few non-vaccine items. That's primarily what Kathy and I will be talking to you about. First off, we've gotten some calls already about the St. Patrick's Day Parade that's normally held in March. Obviously, in 2020, we had to cancel that parade. We expect to be putting out a statement in the next week or two. We're working with the committee on the parade on what exactly to do and how to handle the situation. So more to come on that. So stay tuned, please. On the municipal government side, we have our fire consolidation process that took effect 3 weeks ago on January 1st. So now instead of a fire district model here in town, you have one municipal fire department. That's good from a safety standpoint, both for our residents to be operating under a single structure, but also for our firefighters to operate under a single structure. But it's also a more cost-efficient way of providing our residents and our businesses a fire service here in Hamilton. We estimate that by doing the consolidation process, each year we'll be able to save roughly $1.5 million. That obviously goes to help stabilize our property taxes here in Hamilton. As it relates to COVID, first I want to talk about testing. Our Department of Health on their website, hamiltonnj.com, has put together an Excel spreadsheet of all the places in town and in the county that you as a resident can go get tested. That listing includes the type of test performed, whether it's what's called a PCR test, which is the quote-unquote gold standard for testing, or a more rapid test where you can get your results in under an hour. It also includes turnaround times, cost, if any, to you, and phone numbers if you have to make an appointment or the like, and whether those testing sites provide testing to minors, which is obviously something that as school is now back in session, we want to make sure our students have access to testing. So again, those testing sites can be found at our Department of Health website at www.hamiltonnj.com. Moving now to the topic that's on everybody's mind, that's everybody is talking about, and that's vaccine. We have, as a municipality, partnered with all the other Mercer County municipalities since the end of December in forming what's called points of distribution, or pods. We form these pods with those other municipalities to get members of our Mercer County community, specifically the 1A group, 1 Alpha group, vaccinated. That included healthcare workers, and later it included our first responders, both firefighters, EMS, and police. So we've been doing those closed pods, closed meaning closed to the general public, since the end of December. And it's been a great success. We've been able to vaccinate thousands of residents here in Mercer County. Those pods have traveled throughout the county. We had locally here at Nottingham Firehouse, and then it's rotated to West Windsor, to Princeton. This week is in Trenton, next week is in Ewing, and that allows people from across the county to get tested. It allows those people who qualify for testing to be able to make a more convenient appointment for them. And starting next week, we'll be able to now issue second doses to those first group of people that got their first dose between Christmas and New Year's. So a lot of good things have already started on that. Where do we stand now? unfortunately, the amount of vaccine available to us as a county and as a township is severely diminished, and not nearly enough to accommodate the demand we've seen from you all. Since Wednesday of last week, when the governor announced that those individuals over 65 or under 65 with health conditions can now qualify in New Jersey for getting the vaccine, just in Hamilton Township, we've received close to, or over, I think just slightly over 2,500 calls from people who now qualify. We've put all those people on a wait list. We've taken down your name, your phone number, your email if you have one, your age, or your medical condition if that's the way you qualify. And we will call you as vaccine becomes available to get you vaccinated in an appointment. However, I have to stress, we do not currently have enough vaccine to even start touching that wait list. So what we're doing is encouraging all of you to register through the state website, or the state has also put out a listing of private establishments who are doing testing as well, one of which includes the ShopRite at Marketplace. But all these establishments are doing appointment-only testing. So whether you want to go to the ShopRite and Marketplace, whether you want to go up to Edison or down to Burlington County for one of these mega sites, they all require you to get online and register. The state has now initiated a phone number where you can call and try to get an appointment or get yourself at least on the state wait list as well. My advice to all of you, and we'll talk to Kathy Fitzgerald a little bit, who handles this more on a day-to-day basis, is to register as many places as you can to give yourself the quickest chance to get yourself or a loved one vaccinated. We just had a call with the governor's office this week, and Mercer County now, moving forward, is only getting 800 new doses per week for at least the next few weeks. We're a county of over 350,000 people, and you need 2 doses. So it just goes to show you, at our present allotment, how long this process will take. And I hate to kind of give you those numbers, but I want you to understand where we are at on trying to vaccinate the public. Now, this is something Mercer County and Hamilton have no control over. It's something even the state has no control over. The state only gets 100,000 doses a week from the federal government. Many of those doses are required by the CDC to be reserved for those in long-term care facilities and staff at long-term care facilities. And we currently, as a state, have hundreds of thousands of doses reserved for those individuals that can't even make their way down to the counties or down to the local municipalities. Obviously, we're hoping in the weeks to come that available supply of vaccine dramatically increases. But at this time, sitting before you on January 21st, we really have no timetable on when the amount of vaccine available to us will significantly increase. However, we have made a promise to you all that as soon as we get vaccine, as soon as we have available doses, as soon as we have open appointments, we will start calling people on that wait list to make sure they get your vaccine as quick as possible. But this is not going to be a quick process, and so I want to make sure you're aware of that. So, Kathy, if you can just talk a little bit. Obviously, people know, I think, generally there's 2 different types of vaccine available. Talk about the types of vaccine and what we're seeing as a township in administering the vaccine.
Sure. Well, again, thank you both for allowing me to be here today and being able to talk to our residents. It gives me great pleasure to tell you that our Hamilton Township Health Department is ready and has a plan to vaccinate as soon as we get that vaccine in hand. So I'm very pleased how the vaccine pod has turned out that we did back at the end of December, and as the pods move on through other municipalities, we have participated in that as well. We are also partnering with our school nurses to administer vaccine alongside of our public health nurses when we do get the the vaccine. So our plan is as solid as it can get. We're just waiting for that vaccine. And I'm hopeful that we're going to get that very soon. And I'm really looking forward to that. As far as the vaccine that we've been administering, it's called Moderna. There is also the Pfizer vaccine that many of you have heard about that has been distributed to hospitals and also to the pharmacies, Walgreens, and CVS's through their federal partnership program. Both vaccines basically work the same way. Moderna is a 2-dose vaccine every 28 days for the second dose, and Pfizer is 21 days for the second dose. The side effects of both are hopefully very minimal to most people. The injection site usually is the biggest complaint that I've heard. Sore arm, a little fatigue, doesn't last very long, maybe 24 hours, and people are very pleased with that. So again, we have the Moderna in the local health departments because that is the method of us being able to store that at certain temperatures that are required.
So, Kathy, if somebody, a member of the public here in Hamilton, wants to get the vaccine, I talked a little bit about our wait list and things like that. What can they do to give themselves the best shot, to use a pun, of getting the vaccine?
Sure. Well, as you said, Mayor, they can go to the state vaccine website. That's New Jersey Vaccine Scheduling System, and you can go on to the New Jersey COVID vaccine website, obtain that information, put that in there, and they will let you know when they have vaccine and when it's available to you, depending on the phase that you're in. Locally, we've been taking names, as the mayor has said. We're over 2,500 as we speak, and we've only been taking names for a few days now. So the demand is certainly greater than the supply, but I can tell you that any way you can get your name on any list, whether it be with the township or the state, or even going on to the websites that are private providers and put your name out there, this first call you get is the shot you should take.
In terms of our local health department, you talked about having a plan in place and things like that. How quickly can we get that plan in place once we have the vaccine?
Immediately. Our nurses are ready and on standby. We have our pod sites, we have the firehouses. We also vaccinate at the senior center, and they are all set up, ready to go.
All right. Anything else related to the vaccine you want to share with the public at this point?
Just the mere excitement of getting the vaccine. We've waited this long. 2020 certainly was a year that we've all wished we didn't have to experience, but in 2021 I'm hopeful and I'm excited that we're going to be able to vaccinate our population and keep our community safe.
Now, for those who've been lucky enough to already get the vaccine or hopefully soon get the vaccine, once they receive one dose, do they still need to quarantine? Do they still need to wash their hands? Do they still need to do all the things we've been doing now for 10 months?
Absolutely. Vaccination doesn't guarantee total protection. The vaccination, and we'll just say after the second dose, it takes a few weeks before your body becomes developed to that immunity, but it's not guaranteed 100%. So far, the CDC still recommends, even if we've been vaccinated, that we quarantine if we're in close contact with someone with a positive case.
Now, if you've had the coronavirus, at some point in 2020 or now in the beginning part of 2021, do you still need to get vaccinated?
Absolutely. Again, the guidance that's been given to us is those who have had a positive case may have immunity up to 90 days. That's not guaranteed, so it is recommended that you do receive the vaccine just like the rest of us.
Now, if you've had the virus, if you know you've been positive for the virus in the last 90 days, do you still get a vaccine then within those 90 days?
It is recommended that you can. Certainly you have the immunity for the 90 days, so that the CDC is telling us. But I think on the latter end of that, I would be cautious and get that vaccine as soon as I can.
Okay. We're still currently doing first responders, correct?
Yes.
Have we moved on to anybody on our wait list at this point?
Unfortunately, we have not. We are still trying to do the 1A phase. The healthcare workers are still on the list, especially with our municipal pods, and also our first responders, our firefighters, our police, and our EMS.
So at this point, my understanding is, the governor opened up to some different groups that were not originally on the 1A group. Can you give examples besides our first responders and our seniors of who would be available at this time to qualify for getting the vaccine?
Sure. So he also opened it up for age 16 to 64 and those with a chronic illness. Chronic illness could be something like diabetes or a pulmonary disorder, heart condition, organ transplant, similar to those types of conditions that would make one eligible for the vaccine at this time.
Now, if you're a 16-year-old with one of those underlying conditions, can you get the Moderna?
You cannot. Moderna, it's a very good point, Mayor. The Moderna vaccine is only offered to those 18 years of age and older. However, the Pfizer vaccine has been studied to administer vaccine to those 16 years of age and older.
And is there anybody at this point who's recommended not to get the vaccine?
Well, the CDC would probably tell us that there are individuals who have history of anaphylactic shock and allergies that may not be the best candidate to get the vaccine.
So if you have certain allergies, my understanding is the CDC recommends you talk to your personal doctor first before getting the vaccine.
Absolutely. And then after you get the vaccine, part of our medical observation area, depending upon your potential for an allergic reaction, is we observe you for 15 minutes, and if you've had any type of reaction to vaccines in the past, we'll observe you for 30 minutes or more, depending upon your need.
If residents have other questions that we're not anticipating through this broadcast, where can they go for more information?
Well, they can always go to the state website, which has a lot of information regarding COVID and the COVID vaccine. And they can certainly call our Hamilton Township Health Department. Our nurses are always available to answer the questions of our residents.
Now, the county this week has announced that they're opening up a closed pod as well. Any information you could provide our residents on the county vaccination site?
We have only been told that there are going to be 2 sites at this point. The Cure Arena will be one site that the county will be running, and there is not a formal agreement yet, but there is talk of Mercer County Community College that may be the other site. You must register through the New Jersey registration system. That's how they're taking their potential vaccine eligibility people.
So that you have to be on the NJVSS system.
That is correct.
In order for the county to reach out to you to make an appointment.
That is what I've been told, yes.
Okay. Kathy, anything else? Just, I know it's been a while since we've done one of these, and we've talked about the vaccine and we've talked about testing a little bit, but anything you want to share with our residents regarding the coronavirus that we haven't talked about?
Well, just the coronavirus in general, it's important to still maintain the social distancing, washing your hands, wearing your masks. It does work. It has helped us in Hamilton keep our transmission of the virus down. Limit your social gatherings. I know we just got through the holidays, and as anticipated, our numbers did go up, and that was all over our country. It wasn't just here in Hamilton Township. However, we do have events coming up in 2021. I think the Super Bowl's in a couple of weeks, so you need to keep in mind that follow that guidance. Keep those numbers down. Try to do it remotely, virtually, through Zoom, but please keep the social contact at a limit.
Thank
That
you.
helps us all keep our virus intact until we can get that vaccine in arms.
Thank you, Kathy.
You're welcome.
Dr. Rocco, how are you?
Mayor, nice to see you.
You as well. You as well. So I know you've had a lot going on with the school district, coronavirus related and otherwise. So if you can, I know you do written community updates almost every day, but want to hear what's going on with the school district as well.
Sure. Well, Mayor, it's nice to see you. Kathy, nice to see you again. And I want to, again, express my appreciation to the Township and the Health Department because that collaboration has been very beneficial to our students, our staff, and the community over the course of now, you've said 10 months. And it's hard to believe, but we've done a number of these, especially in the beginning. So first, I want to start with the community and say we continue to give you updates at least once a week, if not multiple times a week. We produce those updates in 3 languages, English, Spanish, and Haitian Creole, and we always post those on the website. You'll get a robocall or a text message telling you that they're out there. Whenever we actually have a case, and we had 2 cases yesterday, one in one school and one in another school, we will also send correspondence out to the community as a whole to keep our community informed of what's happening. So I want to go back to the topic that you talked about a couple minutes ago, which is vaccination. And in conjunction with our health department and planning, we've been able to put out a survey to our staff in Hamilton Township, our employees, and we've had overwhelming response to our employees being on a list to get vaccinated. Now, again, we all know we're waiting on the vaccine itself. But in conjunction with the health department and working internally here, just as Kathy mentioned, we have a plan. We have a structure. We can turn that on and into an area for vaccinations in a very short period of time. And we will, once notified, able to provide our staff with vaccines as soon as we're notified they're available. And that is a result of the planning that's been happening between the township and the school district. The help of the nurses in the township and our school nurses, who have been wonderful during this time. All of our staff have been wonderful, but our school nurses, many of them have worked beyond the work in the schools to help in the community, at the town level and the county level, so I want to thank them for that. So that's number one with the vaccines. We're ready to go. We just need to know, just like everybody else, when it's available. Just as you've said and you've said, I encourage all of our faculty and staff and all community members, put your name on any list that's available. Whichever calls first, go get that first. Don't wait. If it's available to you, take advantage of that opportunity. So that's number one. Number two, just as you're having testing with employees in the district, I will be announcing in writing to our faculty and staff this week that we will begin testing for all HTSD faculty and staff and their families starting in about a week. The details of how that's going to work and how to register will come out in writing to you. About a week or 2 after that, we will open up testing for all of our HTSD students and families, and we will provide that information to our community once we have that information out. This is a good step for us. You know, we want to look to ways to begin to open up our schools. One of the ways we can do that is to have constant testing and tracking what's happening in our schools with our staff and our students. As much as we want to open up more, we are still under the same parameters that the governor set months ago. And actually, prior to taping this, we actually received an email of an update to some information that the New Jersey Department of Education and Department of Health have put together. Haven't had a chance to look at it yet, but we will examine the impact that has on our operations and if there's any guidance on how we can begin to open up more. A lot of it has to do with the regionalization of the state and how they color code the state based on case rates, positivity, those type of things. We are currently orange. It's the second highest. Red is the highest, orange is the second highest. So that has not changed. And so there are certain things we are required to do because we are at such a high rate. But as things change, we will be notifying you and probably doing more of these, right, moving forward, but also in writing to our community. Dealing internally here in the school district, there are 2 areas that I want to focus on, academics and mental health. So, as a school district, and school districts in our county, our state, and across the nation, from an academic standpoint, we are very much aware that our students are not having the typical school year. And when we're not having the typical school year, there are issues with learning, the rate that we're learning. People have called it a COVID slide or a learning delay. It doesn't matter what we call it and what we're talking about here. Basically, what we're saying is that our students aren't learning at the same pace based on the structure of our schools and the restrictions due to COVID. So when it comes to academics, right, let's I'm not talking about remote and hybrid. I'm talking about academics and how we are going to help remediate that issue. We've been providing a lot of tutoring across the district. So we've made tutoring available through December 31st. So I broke it into two categories. Through December 31st in the district, we have provided 760 hours of tutoring, which equates to $30,400 of tutoring in the district for our students. Effective January 4th, we will be allocating another $45,000 worth of tutoring for our students, for what works out to be approximately 1,125 additional potential hours of tutoring academic intervention. A lot of this is allocation due to CARES funding, and if we receive additional CARES funding from the federal government, a portion of that will be allotted to tutoring for our students. It's important for our families to understand that we want to focus on students' academic needs, and so we will be allotting funds for that. We've already allotted some funds. We continue to do that for this school year, and we will continue to do that moving forward. The second part of this, beyond the academics, is mental health. So not only are our students struggling academically, but our students, our staff, our community is struggling with the issue of quarantine pandemic. And so we are putting a focus on mental health from the beginning, social emotional health and mental health for our students. We've provided resources and updates up till we went on winter break, so we would always include that in the community update. We've provided training for our staff, and recently we were awarded a $30,000 grant from the Princeton Area Community Foundation, thanks to our grant writer and a number of other staff here, that will focus on resources and training in the area of mental health, resources for our schools, training for our staff, and then resources for our families. So it's not just about doing something in school. It's also about supporting our families outside of the school day. The important piece of this is the academic issue is going to go beyond a year. The mental health and social emotional health is going to go well beyond a year. So we are committed to working on both issues beyond this school year. It may take several years for us to work through the issues that our students are experiencing through this pandemic and affecting them in respect to their mental health or academics. So when June comes, we're not saying that's it, we move on. This will continue on for a number of years. To that point, we just submitted on Tuesday a grant for learning loss to the state. So the state is going to issue 16 grants. So they had a quick turnaround time, and a great team of supervisors, and again, our grant writer, worked on this grant for $156,000. And it's a learning loss grant. And the concept that we're going with is every teacher is a reading teacher. And the concept is, beyond that, is if you can't read, you can't learn. And so we will be providing professional development and training K through 8 for our teachers in all subject areas. If we're awarded the grant, we have to be awarded the grant. And then coaching, instructional coaching at our middle school levels to reinforce the professional development and help our teachers, specifically in content areas, integrate literacy into their instruction. And then the final piece of this is, and this may not sound exciting to kids right now, but is a reading summer camp, right? And so people are probably, who wants to go to a summer camp and reading? But hold on a second. It's tied to subject area. So we have students that are excited about math, excited about science, excited about history. And so what we would do is we would intertwine literacy with a subject area and take that subject to a new level for kids, making it a little more exciting, something they're really excited about reading about. So we're hoping to get that grant. We'll find out in a couple of months. If we don't get that grant, we will be allotting other funding to move forward with that concept to help our staff and our students. So that's the academic end. That is the mental health end. We're also providing food distribution every Wednesday to our community. It's from 3:45 to 5 p.m. every day. Our pickup locations are at our elementary schools. So it's Alexander, Greenwood, Kistard, Klockner, Cooser, Layler, Langtree, and Wilson. And you can come over from 3:45 to 5 every Wednesday for food distribution. On top of that, we are doing 3 things at once in the school district. Typically at this time of year, we're wrapping up our planning for the summer and planning for September. But because of the pandemic, we are still working on this school year, on how we can modify the school year. We are working on the summer, and we are working on next year. So we're moving forward. With that, we've opened kindergarten registration, and it is virtual this year for our students. It was last year too. But we are excited to invite our kindergarten students for next year to register. Any student that is aged 5 before or on October 1st, please go on our website and click the link and register for kindergarten. It's an exciting time. If you have a neighbor that has a kindergarten-aged child, please tell them to go onto our website, HTSDNJ.org, and register for kindergarten for next year. A couple other academic things that we have going on. We will be giving the PSATs. We're giving the PSATs to our juniors, PSAT 11 and NMSQT on Tuesday, January 26th. And that will be for all juniors. It will be a remote day at all of our high schools for every student except for the juniors who will go in and they will take their test. This is fully funded by the school district. So every year we fund the PSATs for our students 9 through 12. It's a great opportunity for our students to qualify for National Merit Scholarship. It opens the door to AP Potential and provides our students with future assessment readiness, which is the SATs for going to college. And I know that a lot of colleges have said that they're not going to use the SATs for college admission right now. However, some may still do that, and we still want our students to take these tests. Also, one of the things that we're very proud about here in Hamilton Township is the Seal of Biliteracy. So the New Jersey Department of Education's Seal of Biliteracy identifies graduating high school students who are able to demonstrate proficiency in English in addition to English with 1 or more languages. And by achieving the Seal of Biliteracy, students demonstrate they are able to speak, read, listen, and write in 2 or more languages at a high level of proficiency. This celebrates the diversity of our school district, and last year we had 165 students who received the Seal of Biliteracy on their high school transcript, and it's very helpful for post-school planning, college and career. So there is a flyer available and a link on our website. Any student that is interested in taking the Seal of Biliteracy test, please go online and click on the link and fill out the application. If you're having trouble, reach out to your guidance counselor, and this is for high school students. So reach out to your guidance counselor if you need more information. One of the other things that I want to touch base with is due to the pandemic, some of the things that have been traditionally school-related issues or school-related activities have been canceled, postponed, or changed. And one of those things is the arts. We have a proud history of musicians, actors, actresses, and singers in our school district. In the wintertime, we have wonderful musicals, and we have holiday festivals, and we weren't able to really do those this year. We are currently working on plans so that our actors and actresses, our singers, our musicians are able to perform. So we are working with a number of people to figure out options for them. School is academics. School is about social interaction, but it's also about the things that excite you, you're interested in, and you have a passion for. For some kids, that's being a musician or an actor or an actress or a singer. For some, it's being an athlete. Some, it's competing in robotics. So we are looking for ways that we can continue that on for all of our students. More information will be coming out soon. I have 2 other items, if that's all right for you, Mayor.
Please.
We have a focus on equity. It's part of our strategic plan, and it's part of our school year efforts. We have a district-wide book study this year. We've purchased close to 1,800 books for every employee. We're reading Culturally Responsive Teaching and the Brain by Zaretta Hammond, and we are doing a book study across the district every month. And the book study provides an opportunity for our staff to get together from different buildings and talk about the book and talk about the impact that the book could have on instruction and working with our students across the district. And that has been very successful, and I'm very excited about that. And finally, even though the pandemic has adjusted many things for us, we continue our strong professional development movement here in the district. We provide a lot of opportunities for our employees, our faculty and staff, to take professional development. So in the fall and winter catalog, we had over 40 offerings for staff to take. And as of today, we have 549 of our staff registered for fall and winter sessions. There's a little bit about what's going on in the district right now.
No, appreciate it, Dr. Rocco, and want to echo what you said about our partnership and working together. You and I talk, if not every week, nearly every week. I know our health department talks to your nursing department definitely every week. And like the district and the township, we've had to adapt, we've had to overcome, but we keep moving every day to make sure our residents have from the district what they need for their children and their grandchildren to get an education. From the township, not only to be safe health-wise, but we were able to provide a holiday in the park this year at Cooser Park. And obviously we have a lot of other services that we continue to provide as a municipal government each and every day. And so know that while, at least in the short term, while we're all waiting on the vaccine to be available, both the municipal government and the district have plans to get that vaccine to where it needs to be and to the people who want it as soon as possible, so we can start opening up, so we can start getting back to a more normal school year, a more normal life that we had before March of 2020. But it's really through the partnership and the communication between these two forms of government that we're able to do it quicker, that we're able to do it more efficiently, and that we're able to have the plans in place and I think more importantly, the people in place. As Dr. Rocco talked about, some of the school nurses have been with us helping out the municipal health department since the springtime when school wasn't in session anymore. And so they obviously have a leg up on now being able to do some of the other things this year too, as vaccine and the like becomes available. So I think if I can leave you all with one thought, it's that the leadership in the school district, the leadership in the township, through the school board, through the council, and through the people they hire to put in place, whether it's Dr. Rocco or Kathy Fitzgerald, are here working every day for you, are here trying to help us as a community, as a township, get through this as quickly and as healthy as possible. We understand you're anxious, we understand you're excited, we understand your strong desire to get the vaccine, and we're all working every day to make that a reality for you as quickly as possible. In the meantime, please keep doing what you're doing. Wash your hands, wear your masks. We're 6 feet apart, even though we're in the room together. Do those things to keep you and your family safe until we can get you those vaccine doses and we can return to some level of normalcy. So appreciate you all taking some time and watching this. We hope it's been informative. We hope you continue to pay attention to the emails and the community letters that we all put out every week. And most importantly, I think we hope you stay safe.